Hey guys, it's Dr. Emer. I'm in the OR today with Dr. Rojas, who's doing a primary breast augmentation. But the reason I love this case is while the patient's asleep, I'll be coming in as his partner doing facial resurfacing. We're gonna do our Tighten Bright procedure where we do deep microneedling radiofrequency of the face and neck to tighten, and we're gonna do a CO2 laser of the face, neck, and eyes for resurfacing. This is something you should do every year, a bigger treatment every year or two to really resurface the skin, get rid of sun damage, fine lines, and wrinkles, but regular laser treatments and facials and skincare, especially using Emer skin in between to really make the skin look good. We're gonna do a huge rejuvenation procedure today, so come take a look.
Hey guys, day 2 and we keep going strong. Today I'm gonna be doing a breast augmentation on a young female patient. She's small cup size and she wants to be significantly bigger. We're gonna go through the IMF and we're gonna create subglandular pockets for breast augmentation. She's very fit, she works out, so she wants to avoid the bubble and animation deformity. So we're gonna go under the breast gland with this breast augmentation and we're gonna create a beautiful change for her. Stay tuned, come with us.
While we're here, just name what we're doing.
We're doing some CO2 lasers on my face and neck and doing breast augmentation.
Can you tell me why we want to do the lasers and implants?
To make my skin look younger and smoother and yeah.
Can you tell us why you chose Dr. Emer and Dr. Rojas?
Yeah, I came in and did a little Botox and filler with Dr. Emer over the summer. And I found out that he worked with other surgeons, and I had planned on doing breast implants, and I consulted another surgeon, but I just, his whole vibe and all his results were just kind of spoke for themselves, and I just felt comfortable with him. And then I met with Dr. Rojas, and I was sold, so yeah.
Good morning guys, so super excited, second day here in our visit to LA, and we're doing a great case. We're doing breast augmentation, primary breast augmentation in this female patient that we want to augment, give her volume, expand her breast to have more projection and more volume. So let me guide you to do the process. So for markings for breast augmentation, they're usually very simple. I don't like to overdo them. I don't want to distract the process, but I do take measurements, and those are the numbers that you see on the chest. This breast is slightly lower than the other one, the distance from the sternal notch up here, which we can mark, to the areola and to the nipple. This one's slightly 1 centimeter lower, which is normal. I always say they're sisters, but they're not identical twins. And we usually, for the breast, I usually like the midline. And in her case, with the help of the tattoo, this is a properly placed tattoo actually. Sometimes it takes away, but this one is not the case. This one is actually helping us because we mark the center of the chest. So then I proceed to mark the inframammary fold, the current inframammary fold. This is important because, as you can see, she's relatively small and we're gonna go significantly bigger. So if I were to make my incision right at the current inframammary fold, when we put the implant and the pocket expands, then the scar will end up being in the actual breast. And we don't like that. We don't want that. So we go slightly lower. I always go slightly lower when I know that my starting point is a small pocket, small breast, and I'm gonna expand. So I go slightly lower, and that's why in this particular case, I mark the current IMF very clearly, so I know where it is, and I can assess the expansion. And finally, I'm gonna pick red to match the heart, and we go here on the upper border, and I always push the breast up and see where it ends. That way I know exactly where the breast tissue, it starts, and then it's just chest wall. And I do the same here. This one's a little smaller than the other one. Again, that's completely normal. And that will be the delineation of my upper limit. And then here, I don't want to create what they call the uni boob. Basically, we gotta respect the sternal edge in the center. So I mark this right here, and this is basically telling me, no, we don't want to dissect here. We're gonna preserve this area to have a beautiful cleavage. Good morning guys. So We are doing breast augmentation today on a young female patient that wants to significantly enlarge the size of her breast. Let me take you to the images. So if you can see, we're starting with small breast. The left breast is slightly lower, I would say almost a centimeter lower and slightly bigger than the right. But we want to basically increase the size, and we're going to show you other images. We want to increase the size of the breast, and by doing so, we're going to lower the inframammary fold to expand not only superiorly but also inferiorly to fill up the chest much better. We're going to do what we call an inframammary approach, and we're going to create a subglandular pocket. This patient exercises, she's fit, she goes to the gym, and we want to avoid what we call animation deformity by putting the implant above the pectoralis muscle. This will also give us a lift and a much augmented look that she wants, which with a more dramatic cleavage. Another benefit of doing that is preventing any double bubble deformity by having the implant under the breast tissue, not under the muscle. It expands the current breast better, the breast pocket better, avoiding any possible deformities or irregularities or double bubbles. Stay tuned.
Hey guys, we're now doing our tight and bright procedure, and our first part is the tightening portion, which is our deep microneedling radiofrequency. This is Morpheus. You guys could see the gold-plated needles coming out of this handpiece, and these are puncturing into the skin and contracting under the surface. This allows us to get more improvement when we use energy-based devices, and we like doing this in combination or alone. And we're doing this today with laser resurfacing so we can get both tightening and brightening. This tends to be more improvement over time with sagging. So you do this to prevent loose skin, crepey skin, and fine wrinkles, but you always want to combine this with some level of resurfacing and Emer skin. So it's extremely important when treating the skin that you also treat the neck, which is also why we're doing both the face, neck, and eye area today. This gets us more tightening and keeps it more youthful looking, because you're not just treating the face, and over time you won't age in those areas, and those areas are connected. In the old days, people used to just treat their face, and then you could tell their age by looking at their neck. We don't want that. The sagging process occurs in this area too, so it's really important that we focus on treating all the areas to get the most natural looking results. Hey guys, we're now doing our CO2 laser resurfacing, and this is because my patient just wants anti-aging. This is not for scarring. This is something she would do once every year or two to improve the overall quality of her skin, get rid of sun damage, sunspots, fine wrinkles, shrink pores. This is full resurfacing. The skin's gonna peel and give us brand new skin with new collagen. And this laser is the most strongest that we have right now for resurfacing. It's our CO2. So this will allow us to really activate and kill the surface cells, activate the cells underneath to produce more collagen. Large resurfacing here, and to heal more quickly, to get rid of redness and decrease inflammation. It really helped the skin cells turn over faster without developing pigmentation. We developed Emer Skin. My product line is peptide and botanical based, has hyaluronic acid, retinol, vitamin C, and a combination of ingredients you need to help your skin heal. And we're doing that today on her. We're going to apply immediately exosomes, PRP, and Emer Skin to help her heal. But it's really important that you guys follow our Emer Skin protocols using our regimens after lasers, because they were designed to get the best results and improve healing times. So it's very important you treat the neck area. This will allow us to get more tightening and prevent sun damage and wrinkles in this area, as well as some sagging.
A lot of people forget and neglect the neck, so it's really important that you don't, because otherwise it's going to be a telltale sign of aging. If you treat the face but not treat the neck, it'll be noticeable as you get older that your neck is your true age. Now we're doing our CO2 surfacing on the eyes. This is to get a lot of tightening and improvement in wrinkles. And you guys can see we have eye shields in to protect the eyelids. So we're going super strong and we're going all the way down to the lids. This is a really important thing to do every few years to really keep the eyes tighter and brighter. And the lighter skin you are, the stronger you can go. Hey guys, it's Dr. Emer. We just finished our resurfacing tight and bright treatment, microneedling RF with CO2. We're using our anti-age MDX exosome solution with PRP and other poly-GFs and stem cells in here to help her heal more quickly. This is the strongest exosome we have on the market right now to help people heal. You can use it for so many different things, rejuvenation, just topically. You could microneedle it or roll it into the skin. You can get this on after a facial, but we're using it after a strong laser treatment to help her heal more quickly. This is gonna decrease redness and swelling, and it's gonna get her back to where she wants to be at baseline much more quickly, preventing complications.
So we just started making the incision as we planned. We're going slightly lower than the current IMF because we know we're gonna expand the breast into a bigger size, so we want that incision to stay towards the inframammary fold on the lowermost portion of the breast. So skin incision, and then we're going to create the pockets. Hey guys, so we are creating the pocket in the subglandular position, meaning that we're under the breast tissue but above the muscle, the pectoralis muscle. Why? Because this patient is extremely fit. She works out a lot, and we want to avoid what we call animation deformity, where if we put the implant under the muscle when she works out, there's a very high chance that she could have what we call animation deformity, basically contracting the pectoral muscle and displacing the implant from its position, creating a weird, strange looking deformation. Okay, so here are we creating the pocket. We're gonna switch pretty soon now to a deeper, lighter retractor. We wanna make sure that when we are doing this, we stay within the diameter that we know it's the implant that we already selected. So we don't wanna create a pocket that's too big. Basically, we don't want that implant to be floating inside that pocket. We want it tight and nice. So we have to be very meticulous and careful when designing the pocket and doing our dissection. So we created the pockets. Now we are washing the pockets with antimicrobial solution, and we use antimicrobial solution, and we're also gonna dip the implants in antimicrobial solution and betadine to prevent infection as we put the foreign body, basically the implant, into the pocket. We check for hemostasis, make sure there are no bleeders, obstructions, and we exchange our gloves. We use the insertion, protecting sterility at all times. So we're gonna now test our pocket and the size, that is the right size, by using what we call sizers, and we insert the sizers first. That's what's inside right now, and we inflate the sizer to the desired volume, equivalent of the volume that we're gonna use in the implant that we're gonna keep, and we raise the head of the table to make sure that this is the right volume for the patient, for her proportions and the entire frame of the chest. 50. 100. 150. 200. So we are inserting our implant in the funnel. We dip the implant with betadine and antimicrobial solution, And without touching the implant, we're gonna insert it with the funnel in the breast pocket. So we are inserting the implant, we get in position, we put the funnel, the implant is here, and we slowly push the implant into its new home where it's gonna stay. And voila. So we are closing. I close the capsule first, basically the deeper fascia, or I should say the superficial fascial system equivalent to scarpas. That was my first layer. There's no capsule here because this is a primary breast augmentation. Now I'm closing deep dermis and then I'm gonna move to the intracuticular level. 3 layers of closure.